In this module, we will be discussing swallowing disorders and assistance for gold-level patients within the Eating Matters program. Dysphagia is the medical term for a swallowing disorder which can be caused by neurological changes, structural issues, and certain medical conditions. The presence of dysphagia can be a safety risk and can result in poor health outcomes, such as poor nutrition or hydration, aspiration pneumonia, respiratory distress, or even mortality. Swallowing is a complex and rapid process which involves many different muscles to trigger at the appropriate time and move together in a coordinated manner. During normal swallowing, food or liquid travels from your mouth, through your throat, also known as your pharynx, and into your esophagus, without ever entering into your airway or your lungs. When swallowing is disordered, food or liquid can enter into the lungs, which is called aspiration. The most common signs of swallowing difficulty are coughing, throat clearing, or a wet voice quality. However, for some individuals, food or liquid can go into the airway without eliciting a cough response. This is called silent aspiration. It is important to be aware of emergency procedures when assisting individuals here at the hospital. If a patient is experiencing excessive coughing, gagging, difficulty breathing, or changes to the color of their face, you should immediately stop feeding them, remove all food or liquid from within their reach, and call out for assistance. This may mean calling out to staff or pressing the call bell button for help. Remember, if someone is choking, it is important not to hit the person on the back and to encourage them to keep coughing if they are able to do so. Some patients are totally dependent on others for assistance during oral intake and therefore require total feeding assistance. These patients are identified as gold-level patients in our Eating Matters program. This can include individuals with significant memory impairments or those who have suffered a neurological event, such as a stroke. Increased support during oral intake helps to improve the patient's awareness during meal times and will improve their intake overall, especially for those individuals with swallowing difficulty. Patients with dementia can sometimes forget the steps required during oral intake, such as when to open their mouth or when to elicit a swallow. Increased cueing is especially important for these patients. A patient who has had a stroke may lose sensation of their lips or their tongue and may have one side of their face or body that is weaker than the other. When providing total feeding assistance, it is better to use a metal teaspoon that is filled with a level quantity of food. It is important to go at a slow rate when assisting gold-level patients and to allow adequate time for them to swallow. For those individuals who have weakness on one side of their face, food should be provided to the stronger side. Other cues include gently touching the spoon to the patient's bottom lip or placing slightly increased downward pressure to the tongue with the teaspoon. Some patients may benefit from providing an empty teaspoon in between swallows in order to clear their oral cavity of any food that may be remaining. You can find specific recommendations made by the speech-language pathologist on the patient-specific information sheet, which is located in the Eating Matters program binder on each of the units. For some patients, the speech-language pathologist will have also posted a sign in the patient's room, typically located behind the head of the bed, which will reiterate any specific feeding strategies for that patient. Remember to encourage patients to stay sitting upright for at least 30 minutes following oral intake in order to reduce the risk of indigestion, reflux, or aspiration, even if only liquids are consumed. At the end of the meal, you will be responsible for completing the appropriate documentation for each patient, which is then placed in the Eating Matters program binder on the unit. Any additional notes or information you are able to add will greatly assist the next volunteer. In order to maintain the patient's privacy and confidentiality, please be sure not to take away any written information that contains any patient identifiers. There are special disposal bins on each of the units where any paper with patient identifiers, including the patient's name, can be discarded.